Sickle cell anemia is an hematologic disease, genetic blood disorder. Look at this picture, shows that normal hemoglobin and abnormal hemoglobin. Patients experience fatigue and genetic factors. Detail going on. Introduction. Sickle cell anemia is a genetic blood disorder that affects the shape and function of red blood cells. It is characterized by the production of abnormal hemoglobin known as hemoglobin S. Which causes red blood cells to become rigid, sticky, and crescent shaped. This shape embeds the flow of blood and oxygen to various parts of the body, leading to a range of health complications. Definition. Sickle cell anemia is a type of sickle cell disease, an inherited condition where red blood cells are distorted into a sickle or crescent shape due to the presence of abnormal hemoglobin S. The sickle shape cells can obstruct blood flow and cause tissue damage, pain, and other severe complications. Types. Sickle cell disease includes several forms, but the main types related to sickle cell anemia are 1. HBSS, sickle cell anemia, the most severe form, where the individual inherits 2 sickle hemoglobin genes, one from each parent. 2. HBSC, a milder form, where one sickle hemoglobin gene is inherited along with one gene for hemoglobin C, another abnormal hemoglobin. 3. HBS beta thalassemia, a form where sickle hemoglobin is inherited along with a gene for beta thalassemia, leading to varying severity. Causes. It is caused by mutation in the HBB gene, which provides instructions for making the hemoglobin protein. The mutation leads to production of hemoglobin S instead of normal hemoglobin A. When hemoglobin S is exposed to low oxygen levels, it polymerizes, causing the red blood cells to take on sickle shape. Risk factors. 1. Genetics. The primary risk factor is having parents who carry the sickle cell trait. 2. Ethnicity. It is more common in individuals of African, Mediterranean, Middle Eastern, and Indian ancestry. 3. Family history. A positive family history increases the likelihood of inheriting the disorder. Complications. 1. Pain crisis, also known as vasoocclusive crisis, where sickle cells block blood flow causing severe pain. 2. Infections. Increased susceptibility due to spleen damage. 3. Acute chest syndrome, a life-threatening condition characterized by chest pain, fever, and difficulty breathing. 4. Stroke due to blocked blood flow to the brain. 5. Organ damage, chronic damage to organs such as kidney, liver, lungs due to reduced blood flow. Pathophysiology. In sickle cell anemia, the abnormal hemoglobin S polymerize under low oxygen conditions, leading to the deformation of red blood cells. These sickle cells are less flexible and can clump together, blocking blood vessels and reducing oxygen delivery to tissues. The repeated sickling and unsickling of cells also leads to their premature destruction, causing hemolytic anemia. Step-by-step process. 1. Genetic mutation in the HBB gene. Step 2. Hemoglobin S polymerization under low oxygen conditions. 3. Red blood cell sickling, formation of sickle cells. 4. Vasoacculation, blockage of blood flow. 5. Hemolysis, destruction of red blood cells. 6. Chronic organ damage, repeated ischemia. 7. Inflammatory response, inflammations. 8. Compensatory mechanisms, bone marrow hyperplasia, increased erythropoiesis. Signs and symptoms. 1. Anemia, chronic fatigue and pallor due to hemolytic anemia. To pain episodes, sudden severe pain, especially in the bones, chest, abdomen and joints. 3. Swelling of hands and feet in the infants. 4. Delayed growth, slowed growth and delayed puberty in children. 5. Frequent infections due to spleen dysfunction. 6. Jaundice, yellowing of the skin and eyes due to increased breakdown of red blood cells. Diagnosis. 1. Newborn screening, routine testing at birth to identify sickle cell disease. to hemoglobin electrophoresis, a test that identifies different types of hemoglobin to confirm the diagnosis. 3. Blood test to check for anemia and the presence of sickle-shaped cells. 4. Genetic testing to identify mutations in the HBB gene. Nursing diagnosis. 1. Acute pain related to vaso-occlusive crisis. 2. Risk for infection related to spleen dysfunction. 3. Fatigue related to chronic anemia. 4. Impaired tissue perfusion related to sickle cell, blocking blood flow. 5. Knowledge deficit related to disease management. Disease management. 1. Pain management, administration of pain relievers, NSAIDs, opioids during crisis. 2. Hydration, IV fluids to reduce sickling and improving blood flow. 3. Oxygen therapy to prevent further sickling of red blood cells. 4. Blood transfusion to manage severe anemia and reduce the risk of stroke. 5. Antibiotics and vaccinations to prevent inflammations. 6. Hydroxyurea, a medication that increases fetal hemoglobin levels and reduces the frequency of pain crisis. 7. Bone marrow transplant, a potential cure for some individuals through its crisis significant risks. Treatment. 1. Pharmacological, hydroxyurea, pain relievers, antibiotics and folic acid supplements. 2. Supportive care, regular blood transfusion, hydration and oxygen therapy. 3. Curative treatment, bone marrow or stem cell transplant in selected cases. Psychosocial medicine. 1. Emotional support, counseling and support groups to help patients cope with chronic illness. 2. Education, teaching patients and families about disease management and recognizing signs of complications. 3. Social support, assistance with navigating healthcare systems, increase and accessing resources. 4. Lifestyle modifications, encouraging healthy habits to reduce complications such as avoiding extreme temperatures and staying hydrated. Prevention. 1. Genetic counseling for couples with a family history of sickle cell disease to understand the risk of passing the condition to their children. 2. Prenatal testing, chronic villus sampling CVS or annuocenteris to detect sickle cell disease in the fetus. 3. Newborn screening, early detection to start treatment and management as soon as possible. In conclusion, sickle cell anemia is a complex lifelong condition that requires comprehensive management to prevent complications and improve quality of life. Early diagnosis, effective management of pain and complications, and psychosocial support are critical in the care of individuals with sickle cell anemia. Advances in treatment, including the possibility of gene therapy and bone marrow transplants, offer hope for better outcomes in the future. Thank you. Have a nice day.